For some of us, we've been wearing masks a lot longer than you think. Before the new normal, before the virus, we've smiled through the sadness, surrounded by silence. But now, it's time to talk. No matter the distance, check in. Let's stop the silence from spreading and start the conversation about mental health.
So you got to see our promotional video to increase awareness for National Suicide Prevention Month, which started on Tuesday. So September is National Suicide Prevention Month. It's also Recovery Month. And so we have a number of activities going on this month. You can download virtual call backgrounds, signature line add-ons. Brian Bishop sent out an email earlier this week or late last week, I can't remember which one, with links to those things. We also have a number of media spots like what you saw running. A whole bunch of trainings. If you go to our website, fresnocares.org, or the county's substance use page in our Department of Behavioral Health website, you can get more information about what's going on this month. We also have these window clings. You can see these that we'll be making available throughout the county departments. We've been taking coasters to coffee shops and such and making them available across the community. So if you want some window clings, let us know if you want to help us pass those out. That'd be great. All right. This is the first week that I got some feedback via email recommending things that I cover during this, and in one case, things that I don't cover. So I'll talk about that a little bit as I go through the presentation. Some of the feedback I got was that I probably shouldn't focus so much on COVID, that sometimes that's hard for people to hear and get scary, and I agree. I think that, as I've mentioned in many of these updates, one way to cope with your own anxiety or cope with overload is to limit what you see on media and social media and news sites and such. And so for some of you, this might be triggering to watch this presentation and see the focus on COVID. And so I want to give you permission that if that's too much for you or you feel like that's just not something that you want to participate in, you don't have to watch the update. I've been trying over the past few weeks, you might have noticed, I'm going pretty quickly through some of the slides that focus on the numbers. I think that we all understand now what's going on with COVID, and so I don't focus as much on those and more on what's happening in our community and what we can do about it. And also understanding what is being said in the media and what's being, how to interpret the information that's coming at us from so many different sites. So I did want to say that, and then the other feedback I got was to focus on something that was in the media this week, which I'll talk about in a minute. Okay, so across the world, we now have over 26 million cases of COVID and 864,000 deaths, almost a million now. We have in the United States over 6 million cases of COVID and 186,000 deaths. Closer to home in California, we have over 700,000 cases of COVID and just over 13,000 deaths. And we are now at about a 6% positive rate. We'll talk about that in the next slide or two, why that number is important across California. That's a slight decrease. Last week when I reported on this, it was about 6.1. Okay, so cases. In Fresno, we now have 25,542 cases, and we're getting close to 300 deaths. We have 290 recorded deaths, and so we really have seen a significant increase in the number of deaths in the month of August, and I'll talk about that a little more. In terms of hospitalizations, we're seeing a positive trend, a significant decline in hospitalizations. So if you'll recall, several weeks ago, we reached a peak of 313 individuals in the hospital in Fresno County, and now we're down to 172. And that is a significant decline even from last week where it was 230. The ICU is declining a little slower. We went from 53 to 48, but definitely positive direction. In terms of mortality, and this is one of the things I was asked to talk about, specifically a CDC report, which I'll get to in a minute, but the Fresno County Department of Public Health website is updating their mortality review. One of the things I also often get asked about is comorbidities, and that relates to the CDC report. So I did want to mention in here that of the 290 recorded deaths that we have, 214 of those had known comorbidities. 76 we don't know, or they did not have comorbidities. And in terms of mortality in the county, as I mentioned, as you can see on the left, it really shows the number of deaths by month in the county on the left-hand side and valley-wide on the right. And by far, August was our deadliest month. These are both graphs that were in the Fresno Bee actually today. So we essentially doubled the number of deaths we had between the end of July and the end of August. And then if you look on the right-hand side, just for August, COVID deaths were the leading cause of death in Fresno County and across the valley. So there are still people dying of other causes, but by far, as far as any single cause, COVID is the one. Now, Public Health, I asked them to produce this next slide, and they did. It's great. We've talked a lot about as case rates rise, we typically see a lag or a delay before hospitalizations go up, and then a lag or a delay before we see deaths, which is what we've been experiencing. And this graph really shows you that in detail. So the darker part of the graph is the cases. So you can see that cases began rising really towards the beginning of June when we started opening up again. I think we started opening up in late May. And you begin to see those cases go up exponentially. And really peak after the 4th of July. 2 to 3 weeks after the 4th of July is when we hit our peak. And then they went down a little. They went down a little bit before the 4th of July, but then they went back up again in response probably to the 4th of July. Then the lighter color graph, not the line, is hospitalizations. So they lag. Hospitalizations lag the cases. And then the line, the gray line, is deaths. And so you can see that the deaths have went up and haven't quite come down as far as some of the other things, the cases and such, just yet. And we should expect to see what we'll call trailing number of deaths as our case rate declines. So we are seeing declining case rates, we are seeing declining hospitalizations. The trailing of the deaths will continue a little bit. But there's a grave concern about what's coming up, which is Labor Day weekend. Pretty much after Memorial Day weekend, and then after 4th of July, we saw peaks. We saw peaks in cases, peaks in hospitalization, and following that, peaks in death. So we really need to be disciplined. I know it's hard. I know we've all struggled to follow all the rules all the time. But the more you, not just you personally, but family and friends, the less we're getting together in large groups, particularly with multiple households together, particularly in indoor settings, particularly when you're not wearing a mask. That's really the most dangerous situations. And so even prolonged close together with a mask on is of concern. And so the more we can just limit those types of things until we really get that case rate down, we're on the right trend. And that trend, what it will get us is reopening, which I'll talk about next. So there is a new system for reopening. It's gotten a lot of grief in the news, but it is a tiered system. And the purple tier, which is what we're in, is when you have widespread COVID. And this is where many non-essential indoor business operations are closed. And you get into this when you have more than 7 daily new cases per 100,000 in your population, which for us would be 70 new cases a day, or more than 8% positive tests. Substantial is red or orange, I think it is, maybe red, and that is 4 to 7 daily new cases or a positive test rate of 5 to 8. Moderate, which is orange, is 1 to 3.9 and a positive rate of 2 to 4.9, and minimal basically is where you have less than 1 daily new case per 100,000 and less than 2% positive rate. And so for Fresno County, you can see on the left-hand side, we're at 16.5, where we need to be less than 7, and we're at 11% positivity, where we need to be less than 8. Once we achieve that, we have to be at that level for 3 weeks to move down to the next level, which would allow more reopenings to happen. So it's really imperative as we go through this holiday weekend that we maintain the gains that we've made against reducing the spread and keep our hospitalized numbers down. So do more than cross your fingers and say prayers. Follow the rules. All right, so what I was asked to talk about was CDC published a report, and it's on their website, you can go look at it, where they find, where this headline from the International Business Times says, CDC finds only 6% of coronavirus deaths are solely from COVID-19. Now, we've talked a lot about how there's lots of different divisiveness going on in our society today, and many people think we don't need to wear these masks, it's a waste of time, that COVID doesn't, 99% of the people who get COVID will live, and so why are we really destroying the economy because of COVID? And one of the things that they focused on is there must be some lies happening on the death counts. And people who are dying of other causes, it's being attributed to COVID. And so there was really a lot of focus on this particular report because it seemed to support that if only 6% of coronavirus deaths are solely from COVID, then it must be true. Maybe those death certificates are wrong. So what I would tell you about that is that clearly shows a lack of understanding about what is reported on a death certificate. So when someone gets COVID itself does not kill people. There is no unique COVID cause of death. COVID wreaks really significant havoc on the body, and depending oftentimes on your age range or your health or underlying conditions that we're still learning more about, you may develop what's called adult respiratory distress syndrome. You may go into septic shock. You may have any number of heart and other conditions that are triggered by your body trying to fight off this virus. And that's why people get put on ventilators, because they develop adult respiratory distress syndrome. So if you die of COVID and you've been on a ventilator, likely there's going to be a number of diagnoses that go into what you died from. And COVID will be listed on the death certificate when they know you had a positive COVID test and they believe that that contributed to your death. Now, am I telling you that there's not a single death certificate out there where there might have been something that contributed more than COVID? I'm sure there's a small handful of those. But by and large, these are significant health impacts why people are dying of COVID. And so death certificates, by design, you put any underlying health condition that might have contributed to the death. So if someone has high blood pressure, they would not have died normally, they were not close to death, but they got COVID, and maybe the underlying health condition that gave them high blood pressure made them more susceptible to adult respiratory distress syndrome or cardiac problems or that type of thing. And so they ultimately developed other conditions or a multitude of conditions that contributed to their death. what the CDC said, and if you can go on their website, which is exactly what I did. First, I went to the International Business Times to see where they got their data. Then I followed the link to find out what the CDC website said, and it shows you all the underlying health conditions, and most of them very easily you could see how your body fighting off a virus could cause those things to happen, and you could very easily see how someone could have died with these underlying health conditions. Now, there are some individuals, I'll use it for example, some of the younger people who have died who had significant underlying health conditions. Again, not things that they ordinarily would have died from this summer, but because they got COVID and their body wasn't able to fight it off as well, then it did contribute these underlying health conditions. But if you still doubt me, if you still think, maybe that makes sense, maybe that doesn't, there's a couple of other places that you can look on the CDC website that might help you get a better feel for whether or not these death certificates are telling the truth or not. So the next slide is going to show you the weekly number of deaths from all causes across the United States since January 1 of 2017. So you can see in January of 2018, likely because of the flu season, there was a peak there, and where you see those little red marks, that is where excess deaths occurred that year. So it's not unusual in any given year to have some excess deaths. On the right-hand side, you see that starting in about April of this year, which is typically past the flu time, we started to see a spike in deaths in excess of COVID. So the blue bars show you the deaths. The red, the orange line is kind of a standard deviation above expected deaths. So if expected deaths, for instance, are 5,000, you had to have more deaths than, say, 5,250 for it to be counted as an excess death. So it's not just going over the average, it's going above the average beyond what you would expect. So it accounts for normal fluctuations from one month to the next. And if you add up all of those excess deaths, it comes out to a little more than what's been recorded so far for COVID deaths in the United States. And then the next slide shows you for California, and it's almost exactly the same. Those excess deaths started in April, a little different curve than what you see in the United States. And then if you add them up, it's very close to what's been recorded as COVID deaths. So it's just another way for you to do research and check the numbers when you're seeing something out there that doesn't make sense. If you look at that source and you follow the lines, if the article that you read doesn't tell you where they got the information, personally, I wouldn't believe it at all. But if they tell you where they got the information and you can go and look at it, you can usually tease out really the truth between the lines, we'll say. So this particular interpretation has been debunked across several news sites. There's still some that say that it's true, and so again, I would encourage you to go to the source, go to the CDC's website. If you are having a hard time finding it, feel free to email me and I'll send you the link to the website. It's pretty comprehensive. It has all kinds of information, and on the same page is the link to the excess deaths information. All right, so that's my subject to interpretation. So what can you do? If this presentation or any other presentation is just a little too much for you, a little too scary, a little too overwhelming, take a break. Just take a break from this, take a break from your other news feeds, social media. I've done that a couple of times and I know it's been really healthy for me. And then find ways to separate work from home, particularly if you're teleworking, but even if you're coming into work, find ways to take that break. And to that end, I'm going to show you a few things. I think most of you know that I'm a physical therapist, and so the next 3 slides are just little handouts on some neck pain stretches for office workers, and this is for people sitting in front of a computer all day, which pretty much all of us are doing right now. And then the slide after this is a 7-minute exercise routine that you can do at your desk or in your office. home or at work. Doesn't require any extra equipment except for a chair. You can do it with your body. And then the final one is a little more detailed, a workout at work. And so after this meeting today, I'm going to send these handouts to all of you via email, and we'll post them on our website. I do think one of the things that I've struggled with through the pandemic as I've tried to manage my own stress and anxiety levels is I haven't worked out as much as I usually do. And one of the reasons I haven't done that, I think some of you know I had knee surgery during the pandemic, minor knee surgery, a meniscus repair, and I've had some lingering problems from a secondary issue since then. And the things that I typically do for my workout are running and spinning. And those are the things that cause my secondary knee problem to be irritated by. So I've really struggled to find ways to work out. So I am going to commit to doing some of these routines myself as part of my own self-care and the things that I need to do to manage my stress and anxiety, and I encourage you to do the same. If these don't work for you, if you have some sort of health condition where it's hard to do this, there's a number of different activities here, and hopefully some of them you could adapt. But if you want any advice from me on how you could adapt your routine, let me know, and I'm happy to assist you. All right. Wear your mask, physically distance, and for goodness sake, do not come to work sick. I will say that each week now. And remind you. So we're going to go to questions. All right. Someone reported that International Business Times is rated mixed for factual reporting, some true, some false. Yes, we have a number of news sources. Those of you who read a lot of the news, I read a lot of the news, learn over time kind of where to get your information based on accuracy of the information. And there's a number of websites that are independent websites that kind of rate news sources for liberal versus conservative and factual versus mixed. And I would agree. I have found International Business Times, and there's another one that's just called Business Times, to have, I've read articles in some of them that go something like this. Sources say that this happened, but we've confirmed that it didn't happen. But the headline says, sources say this happened. So I really, if you're going to read the news, I would just try and find balanced reading habits, whether that's finding one news source that presents both sides, or if you like to read a more liberal side or a more conservative side, read one from each. That's what I tend to do. I look at multiple news sources, particularly if I see something that sounds really inflammatory or really extreme on one end or the other. I'll almost always do a little further digging and get the perspective of the other side, or go to the source, as I did with the CDC data. And I encourage you to do the same. That's really a great way for you to maintain a more even-keeled approach and really get both sides of the story. I don't have any more questions now, but I will say that, again, Labor Day is coming up. I hope that each and every one of you finds some time to spend with your family or friends in a safe, socially distant way. And more importantly, find time for yourself to relax, attend to your own self-care, and stay safe. All right, thank you. Have a great weekend.